feeling tired after meals, or noticing that burning in your feet. Many seniors think that's just diabetes, but the real hidden cause might be vitamins your body stops absorbing after 60. And here's the surprising part. Missing them doesn't just raise blood sugar, it can quietly damage your nerves and independence. Today I'll reveal the 3 essentials every diabetic senior should know, and the third one flips common wisdom about supplements on its head. After 60, blood sugar becomes harder to control, not just because of insulin, but because your body loses the ability to use 3 key vitamins. I've seen this in thousands of patients: the creeping fatigue, the restless nights, the silent rise in lab numbers. Left unchecked, it threatens mobility and independence. But there is hope. Research now shows that when seniors replenish these vitamins in the right form and dose, blood sugar stabilizes, energy returns, and daily life feels lighter again. And while I'll share protocols, always consult your doctor before making any changes. 1. Vitamin D, the cellular command center. Let's start with the nutrient that acts like the switchboard operator of your metabolism. Vitamin D. Most people think of vitamin D as just the sunshine vitamin for bones. But inside your body, it's more like the command center for insulin release. Here's how. Every pancreatic cell has tiny locks, called vitamin D receptors. When vitamin D enters, it turns those locks, opening calcium channels so insulin can flow out and escort sugar into your muscles. Now, here's the challenge after 60. Those locks, they start rusting. Your skin produces less vitamin D. Your kidneys convert less into the active form. And without enough vitamin D, your insulin key struggles to open the door. That's why sugar lingers in the bloodstream longer, causing fatigue, inflammation, and silent damage to vessels. A major study in 2024 followed over 40,000 older adults for more than 7 years. The results? Seniors with low vitamin D had a 19% higher risk of developing diabetes. But those who kept their levels at or above 40 nanograms per milliliter cut their risk by up to 76%. That's not a small difference. That's life-changing. Let me tell you about Frank, one of my longtime patients. At 71, he was exhausted by mid-morning, even after a good night's sleep. His blood sugars were creeping higher, despite careful eating. When we tested, his vitamin D was low. We started him on a simple protocol: 2,000 international units of vitamin D3 daily, always with his largest meal for better absorption. Within 3 months, his glucose stabilized, his afternoon crashes eased, and he told me, "Doc, I feel like I've got my mornings back." So, what's the takeaway for you? If you're over 60, consider having your vitamin D checked. Talk to your doctor about aiming for that sweet spot, around 40 nanograms per milliliter. And if you supplement, make it vitamin D3, taken with food that contains a little healthy fat, like olive oil or avocado. But here's where it gets interesting. Vitamin D may steady your sugar, but it's not the only nutrient diabetics lose with age. In fact, the next vitamin is critical for protecting your nerves, and most seniors don't realize how quickly it slips away. 2. Vitamin B12, the neural network protector. If vitamin D is the command center, then vitamin B12 is the protective insulation that keeps your body's wiring safe. Without it, those wires spark, fray, and eventually burn out. Inside your body, B12, especially in its active form, methylcobalamin, creates and maintains the myelin sheath. That's the fatty coating around your nerves. Think of it like the rubber around an electrical cord. As long as the insulation is strong, the signal flows clean. But if it breaks down, the current leaks, and suddenly you feel tingling, burning, or numbness. Here's the problem. After 60, the stomach makes 40% less intrinsic factor, the very protein needed to absorb B12. And if you're taking metformin, a common diabetes drug, it blocks B12 even further. The result? a slow, silent decline that most seniors mistake for just aging. A comprehensive review in 2013 found that up to 1 in 3 diabetics on metformin develop B12 deficiency. And here's the hopeful part. Treatment with 1,000 micrograms daily restored levels and improved neuropathy symptoms within weeks. That's the power of replacing what's missing. Maria, 68, lived this firsthand. She came to me saying, "Doc, my feet feel like they're on fire every night." She thought it was irreversible nerve damage, but her labs told another story. Her B12 was critically low. We switched her to daily methylcobalamin, sublingual for better absorption. Within 3 months, the burning eased, her sleep improved, and she told me, "I can finally walk to the mailbox without fear." So, what's the protocol? Most seniors benefit from 100 to 1,000 micrograms daily of methylcobalamin, preferably in the morning or under the tongue. For those on metformin, some doctors recommend an annual injection to bypass absorption issues entirely. And here's a tip. Combine it with folate to ensure balanced methylation. But what most people miss is what comes next. Because while B12 protects your nerves, there's another vitamin that acts as a repair technician for your very DNA. And without it, your risk of stroke rises sharply. 3. L-Methylfolate, the DNA repair specialist. If vitamin D is the command center and B12 is the protective insulation, then L-Methylfolate is the repair technician, the one who fixes broken code before it spreads damage. Inside your body, L-methylfolate fuels 1-carbon metabolism. That's the pathway your cells use to repair DNA and clear out homocysteine, a toxic amino acid that builds up in the bloodstream. But here's the catch. After 60, the MTHFR enzyme, the machine that converts ordinary folic acid into the active form, slows down dramatically. It's like running a factory with broken machinery. Raw materials keep piling up, but no finished product rolls off the line. The result? Homocysteine builds higher and higher, quietly scratching at blood vessel walls. For diabetics, that translates into a stroke risk nearly 80% higher if homocysteine isn't controlled. A 2020 study from the Cardia trial followed more than 4,700 participants for 30 years. Those with the highest folate intake had a 30% lower risk of diabetes. But here's the nuance. It wasn't folic acid pills. It was active folate doing the work. James, 73, saw this play out in his own life. His doctor flagged high homocysteine, warning him of stroke danger. He was already careful with his sugar, but no one had ever checked his folate. We added 800 micrograms of L-methylfolate daily, always with meals. Within 6 months, his homocysteine dropped, his labs improved, and he told me, "For the first time, I feel like I'm not just managing diabetes, I'm protecting my future." So, what's the takeaway? If you're over 60 and living with diabetes, standard folic acid may no longer cut it. Consider asking your healthcare provider about L-methylfolate, 400 to 800 micrograms daily. It's the form your body can actually use, bypassing genetic and age-related roadblocks. And here's why this matters. Ignore folate, and you're not just facing sugar spikes, you're gambling with brain health, circulation, and independence. And this brings us to a critical correction. Because most seniors still believe that any folic acid supplement is enough. But what most people don't realize is, after 60, that assumption can be dangerously wrong. When you step back, these 3 vitamins aren't just pills on a shelf. They're tools your body once made plenty of, but after 60, the supply lines weaken, and that's when fatigue creeps in, nerves start to burn, and independence feels fragile. But here's the good news. When seniors restore what's missing in the right form, at the right dose, cells respond. Blood sugar steadies, energy returns, and life feels lighter again. And maybe that's the deeper message. Diabetes isn't just about numbers on a lab test. It's about mornings with energy, evenings without pain, and the freedom to enjoy time with the people you love. So, let me ask you, of these three vitamins, which one speaks most to your story right now? Type it below in the comments. Your experience may be the encouragement another senior needs today. And remember, staying healthy isn't just for you. It's for your family, for the moments still waiting, and for the independence that makes those moments possible. If this brought you clarity, please tap subscribe. Each week, we explore practical ways to stay strong, mobile, and vibrant after 60. Because your best years aren't behind you, they're still unfolding.